Here with me exclusively is Dr. Mehmet Oz, CMS administrator. All right, Dr. Oz, people might think you're an unusual guest to have out of that introduction, but you have some news for Governor Walz about certain government funding that is related to this. What is it?
Well, we have just sent a letter to Governor Walz alerting him to something he probably fears and should have taken action in a timely manner to avoid. We are auditing all of the Medicaid bills, in particular for the 14 programs that he and his own administration have admitted were problems, and we're going to claw that money back from the Medicaid monies that they'll be getting. Now, this is a major problem for the state because they've got to own the fact that they have been bilking the federal taxpayer for their sloppy behavior for years. What we have learned so far in Minnesota is just the tip of the iceberg, perhaps the largest Medicaid scam ever, taking place throughout the state in many different fashions. But just alone with the things that we're concerned about, we're talking about $500 million or more of money that could be in places that we're not even sure how it was billed, where it went. People are having trouble tracking it. We challenged the Walz administration to give us a corrective action plan by the end of the year. They sent us something after hours on New Year's Eve. It was completely insufficient. This is an appropriate response from the federal government. President Trump is very clear on this. He doesn't want 6 million people or less living in Minnesota to have all the fraud that happened in that state paid for by all the other taxpayers in the country. And for the 6 million people in Minnesota, Governor Walz let you down. His administration, despite all the blustering now, did not do their job. They did not take these very credible allegations over the last several years seriously. Just in the time that I've been administrator, they've been telling us that they have this handled. They did not. And so the corrective action plans that they have submitted, since they are inadequate, we're going to demand that they fix those problems, and we're going to claw back money to protect the federal taxpayer.
Well,
our job is to make sure the most vulnerable are protected.
Well, how much money do you think we're really talking here, Dr. Oz? I mean, we've heard every number thrown around. I think it's probably more in other states like California. Perhaps other states will learn more, I hope. But this is a web of corruption that existed in Minnesota. But Americans want to know how much they were ripped off by. Do you have a guesstimate?
It's billions of dollars without question in Minnesota, we believe, if you pull all the different programs together. But you're right. California is the varsity team. Minnesota was JV at this game, we believe. And we already know, just looking at one specific little minor seeming issue, which is the number of illegal immigrants getting covered by state Medicaid programs. Now, these are theoretically programs that only state taxpayers have to come up with. In California alone, we already have $1.3 billion that they're actually paying us back on because they know they're ripping off the federal taxpayer. What that means, Laura, is if you're watching me and Laura's show in Texas or California or even New York, Texas, Florida, or even New York, you're paying taxes that go to California taxpayers wrongly because we should not be paying for illegal immigrants in any state to get elective health care.
But this has been going on for decades, clearly. This has been going on unchecked. It's amazing that people are asleep at the switch. But it does seem, Dr. Oz, like this was just this was a trail of money, for the most part, from Democrat leaders to Democrat constituents for Democrat causes, with the veneer of we're helping the kids or the autistic children or the children in need. So it has the trappings of being something very nice, but underneath it all, there are people who learned how to rip us off and learned well. They're really good at what they did.
Well, these fraudsters, and you're right, Minnesota Nice made it easy for them to make out like bandits. But let me share something with you that I learned recently. By federal law, if you sign someone up for Medicaid, you also give them the right to vote. So ironically, it's true for SNAP as well. As you give out social services, you also get them registered to vote. So you're building up a very partisan group of individuals. This is political patronage at the expense of Medicaid. The criminal part here is not just a horrible waste and fraud and abuse of our federal tax dollars, but you're taking money from our most vulnerable citizens. If you're lying about the fact that you have Somalian kids pretending to be autistic, that takes services away from kids who truly have autism. You're trying to make money off of an illness that is a challenge that's already significant, and you're penalizing our most vulnerable. This president Secretary of Health and Human Services, Bobby Kennedy, will not tolerate this. We're aggressively going after this fraud. Jim O'Neill and I are pursuing this aggressively on social media, and you're going to see more and more letters coming of us, very specifically outlining the increasing vice grip of financial penalties that Minnesota is going to pay for unless they deal with this issue seriously.
Yeah, we need a lot more people going to jail, too, but that's not your bailiwick. Dr. Oz, I want to turn quickly to the issue that exploded other heads, which was the CDC's decision to reduce its schedule of the number of recommended vaccines to children. And there was 17 on the list. Now it's 11. Some of the vaccines and immunizations that are no longer universally recommended include like the RSV, flu, and COVID, as well as hepatitis and meningococcal vaccines. Explain why these have been cut and why people should not be alarmed.
This is all about choice. If you love your kids, you want to kick the tires, make sure the car seat fits right, make sure the kid's correctly buckled in. So we're asking the healthcare system to do the same thing. And as we do that, we're alarmed by the fact that a lot of parents no longer trust the vaccine schedule. Too many shots, too many illnesses that you've never heard of that you're being asked to protect your child against. So the president insisted we look overseas. We have a consensus now of advanced developed countries who have sort of all come together around this, 11 major diseases you want to protect against. So we care more about measles and polio from ailments you've never heard of. Not all illnesses are equally dangerous. Not all matter as much to you. We want you to focus on this core group of vaccines. Get those vaccines. The other ones you should talk to with your doctor. You're welcome to get them. You're allowed to get them. We will pay for it no matter what. My job is to make sure these are covered. You will have access.
The American Academy of Pediatrics went after your decision, essentially saying that you're killing public trust in public health by doing this without consulting the experts in the field. They weren't consulted, and they're basically saying, this is implying that this entire thing is political.
The American Association of Pediatrics is a captured organization, and we don't believe they actually even represent half the pediatrician community anymore, who are out there saying, what are you guys doing? What are you talking about? Our challenge is to protect our children, not to be a political lobbying group or to launch grenades when folks get to the root causes of why so many Americans don't trust the system anymore. Let's agree that not all vaccines are equal. Not all kids require the same access to those vaccines because we're all different. Some kids are high risk, will want more vaccines. Give the mothers the choice. No one loves your child as much as you do. Even your pediatrician, or more importantly, the American Association of Pediatrics, doesn't love your child as much as you do. We give you the authority to decide with your doctor what's best for your child, and I will pay for it as the director of CMS per the president's instructions. There's going to be an access to all these vaccines. It's up to you to choose what you desire. Get them all if you want. Get just the ones we think are essential if you desire. The choice is yours.
Yeah, well, they're seeing their own grip on medical influence declining. They're more upset about this, about you withholding expert consultation than they were about China withholding information on COVID. So, Dr. Oz, thank you so much.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.